Hi, I'm Simon Barthold from www.bartholdbiomechanics, and this is Langer UK TV. We're talking about a whole lot of different sports injuries here today. Okay, so now we've got shin injury. Shin injury is one of the great bogeymen for all athletes, I guess, because it's so common, it can be really painful, and the biggest problem for me is that it can be one of a couple of different conditions. I suppose I would think about three main conditions here when somebody presented to me with shin pain. So we might be thinking about the ubiquitous shin splints, which is a term we don't like to use, but you still read about this a lot in the literature. Now, I'd encourage you to completely stop using that term because shin splints doesn't mean anything at all. It's a bit like headache, and headache obviously can be anything from a mild stress problem to a brain tumour. The key for us is we want to be getting a diagnosis. Okay, so we always want to be trying to, if possible, make a diagnosis. So we don't call it shin splints anymore. We tend to call it medial tibial stress syndrome, which gives us a better understanding of where it is, some of the structures that are involved, and if we can do that, it gives us a bit of a guide for treatment. So we're going to talk about medial tibial stress syndrome. We're also going to talk about compartment syndromes, which are completely different, and I'll explain those in a minute. And then finally, we're going to talk about the condition that can masquerade as either of those two things, and that's a stress fracture. All right, so let's start off by talking about medial tibial stress syndrome. So this is a very common condition, especially in runners. It's particularly common when athletes who might be perhaps playing ball sports like soccer or football are involved in pre-season training. They're ramping up their running. They're often on hard grounds, and they're very often in very bad footwear, aka football boots, which are horrible. Now, wearing a football boot is a little bit like wearing minimalist footwear. If you haven't taken the time and effort to adapt to the lower heel position and to the more flexible nature of the boot, well, then you're really setting yourself up for a bit of a problem. So we have to be very careful and recognise that. Shin splints has a really quite typical presentation. Gradual onset, it develops typically on the medial crest of the tibia. So we usually see it in the lower 1/3 of the tibia, and it's not actually on the bone, it's on the softer tissue just to the inside of the bone. So we can normally palpate along this area. The athlete will normally say, yep, that's really quite uncomfortable, and the diagnosis is basically made clinically on that basis. The key differential between medial tibial stress syndrome and a stress fracture is that the pain is over a diffuse area, so it's over a larger area. With a stress fracture, which can present in exactly the same manner, so gradual onset shin pain with exercise, but the athlete will be able to isolate the pain in a far more focal manner. So they'll be able to put their finger on it and say, this is where it hurts, and I, as the examiner, will be able to find a spot that is really painful, so it's not over the same broad area. So that's the key differential diagnosis or the differential examination for tibial stress fracture versus medial tibial stress syndrome. Okay, so we're going to stick with medial tibial stress syndrome. What is it? Well, it is an overuse injury, and basically what is happening here, we think, again, like a lot of sports injuries, not absolute certainty with what's going on here, but we think that it probably involves some inflammation of the deep flexors of the leg, so the muscles that are controlling the flex of the toes and the foot. It may also involve the big important muscle called tibialis posterior, and it may also involve the fascia. Now, all of these structures are intimately involved with the tibia itself, the bone, and they all at some point insert into the bone. So we think that what's happening here is that these structures are being overloaded. Impact is important. Sudden increase in mileage is important. Going to a lower drop shoe is important because it tends to put all of these structures on more load. So we think that they're getting overloaded. They basically can't cope with it. They complain, they get inflamed, and inflammation eventually leads to pain. So that's the basic mechanism of the injury. As an overuse injury, it's very much involved with, I think, training errors. So a lot of athletes try to do too much too soon. A lot of athletes change things, so they might try to change their running style. They might change their footwear to something that is completely different to what they've been accustomed to. They might be bumping up their running, doing much higher mileage. They might be doing things like starting to do a lot of hill running very suddenly. Changes, I think, are good in terms of mixing up your training, but they have to be introduced gradually, and you have to actually understand how to integrate that into your training program. If you suddenly change something, then you are setting yourself up for a bit of a fall. So it's very important as a clinician that you get that information from your patient, become good at taking a good history, understand what they're doing with their training, understand where the flaws in that training may be. Alrighty, so we've got the injury. What are we going to do about it? Well, there are a couple of things that we would be wanting to do. So again, as with every injury I'm going to talk about today, we wanted to have a look at strength and flexibility issues. We wanted to have a look at the biomechanics. Guys, biomechanics isn't the foot, biomechanics is the whole body. It's understanding how everything works together, especially important in dynamic gait. So we want to be looking at proximal structures, distal structures. We want to be trying to understand whether the muscles are firing in the proper sequential pattern. We want to be looking at ranges of motion. Is the athlete showing a deficit somewhere? For example, are they struggling to get adequate dorsiflexion of their big toe? If they are, they've got to find that range somewhere else. If they find that range somewhere else, then it throws all the systems out of whack. And they're the things that we need to really be trying to focus on understanding. And once we understand them, we have to address those issues. So biomechanics, strength, flexibility, very, very important. Training, very, very important. Get a handle on what they're doing, and if you can find a fault, then you need to fix that straight away. Footwear, very important. Try to understand what's going to work best for your athlete, and try to make recommendations about change. In terms of treatment, one of the things that's quite important here is to try to settle down the inflammation. One of the ways you'll do that is with friction through this area, sometimes called stripping. Rosie is an elite athlete, is very used to having this treatment. It hurts, but it works. So I'd recommend that you get involved with a good sports physiotherapist or a good sports massage therapist. These guys are absolute experts at this particular therapy. You can also teach the athlete a certain degree of self-help here, so you can actually teach them how to do this. Icing is also very important. You can either do it with a frozen ice block on a pole, so you can institute a degree of massage as well, or the good old bag of frozen peas also works quite well. Just be aware that ice can burn the skin, so you want to be wrapping it in something and don't use it for more than 20 minutes at a time. In terms of trying to improve ranges of motion, that gets back to your therapist advising you in terms of what you need to be doing to try to improve perhaps the range of calf muscle length. I think strengthening is also very important. So one of the key mistakes that people make when they're trying to transition to a more minimalist shoe is that they think that they can just go out, run in the shoe, and everything's going to be fine. Unless you've been prepared to do the work to increase your range of motion and perhaps more importantly precondition the muscle strength-wise, you are potentially setting yourself up for failure. The same thing applies with posterior medial shin pain. I think focusing on the strength of the muscles is very important. So we can look at things like using TheraBand, we can look at, again, eccentric muscle programs to try to improve the strength of the muscle. All of these things are very beneficial to try to get better conditioning within the muscle tendon complex. Biomechanics we've talked about, very, very important. I think, again, if you are seeing somebody in gait who's not functioning correctly, especially if we're dealing with somebody who is pronating at a time when they shouldn't be pronating, and perhaps I'll just explain that I don't think overpronation itself is such a big issue. I think the timing of pronation is very important. So if you're still pronating when the heel is lifting, that's absolutely a time when you shouldn't be doing that. It means that the muscles are having to try to countermand that action, trying to counteract it, and that is a very, very strong signal for overuse. So we do take quite a bit of note of that. If we identify it, then we might want to be looking at a taping protocol to try to improve the position of the foot, we might want to be looking at some sort of intervention with an orthotic. That can be a prefab, like the bioorthotic. It can be a custom-built orthotic. That's going to be a case-by-case decision. But that therapy, I think, with shin pain is very important if we do recognise a biomechanical deficit. Taping up in the shin can also be quite handy with tibial stress pain, medial tibial stress syndrome. We normally try to look at compression. We sometimes look at wrapping the tape around to bring the foot into a more inverted position, because that takes the load off these structures, and that can be very, very effective. You can actually go onto my website and you can see some videos there on taping for medial tibial stress syndrome.